If you have bleeding gums when you brush or floss, you need to watch this. Like most Americans, you probably don't brush and floss properly. Are you brushing twice a day with an electric toothbrush and also flossing every single night? If you aren't doing that, your oral hygiene may not be the best it can possibly be. And so sometimes when you're brushing or you're flossing, you look down and there's a pool of blood in the sink, which is kind of gross. So what is that? We're gonna go through exactly what that is, how you can prevent it, how you can make it better, and what are the different stages of gum disease. Hey guys, Dr. Nate here at Thrive Dental. Let's talk about gum disease. And there's kind of two main differentiations when we're talking about gum disease. Number one is gingivitis versus periodontitis. And what is that? Gingivitis is essentially just inflammations of the gingiva. And that is normally the first stage or the first thing that happens, and that will lead to bleeding gums when you're brushing or flossing. So why do you get gingivitis and how can you prevent it? Gingivitis and periodontitis, which we'll talk about later, are basically both due to poor oral hygiene, and that is basically bad brushing and bad flossing. So if you do not brush and floss properly, what happens is you have a bunch of bacteria and biofilm that gets stuck on the teeth and on the gums, which causes inflammation, just like it would cause anywhere else in your body. So when you go to brush or floss, you're gonna be pushing on that gum tissue, which is inflamed, and it's kind of like pus and blood and stuff are flowing out of it. But that does not mean stop. And I always tell patients, if you see blood, that is a sign of unhealthy gums, but typically that doesn't mean you wanna stop unless it's just bleeding like crazy, which is a different problem. But if it's just bleeding a little bit, you wanna make sure you're getting in there and getting all that bacteria and gross stuff out of your gums and away from your teeth so that they can actually get healthy again. Another way to help it is if you come in for your regular dental cleanings. If you're coming in roughly every 6 months, you're probably just gonna get that normal prophy. But if it's been a while and it's been a few years, you might need to get a deep cleaning. I talk a lot about deep cleaning and the difference between a deep cleaning and a prophy, and I'll probably have a link here, wherever, and that will link to the other video. But remember, if you're coming in for your cleanings every 6 months, it's probably just gonna be a regular cleaning. So what's the next stage after gingivitis? If you've had gingivitis for a while, your bleeding gums have gone worse, or you've just had it for a long time and you really haven't got a professional cleaning and your brushing and flossing is not that good, the next step probably is what's gonna happen is something called periodontitis. Periodontitis is basically an inflammation of the periodontium, or the tissue around the teeth. So this is what happens. The teeth are actually held on by ligaments. So they're not just like directly into the bone, they're kind of held on by ligaments. If that tissue or that surrounding area around the teeth gets inflamed, so this can lead to tissue loss and bone loss, and that is an issue, right? If the periodontitis gets worse, the teeth won't be as in bone as much. And that is why sometimes patients come in, and you may know people like this, that their teeth are really mobile, and that's because they have aggressive or severe, at least moderate periodontitis with bone loss. So how do you prevent this? How do you prevent gingivitis and periodontitis, and how can we just make everything better? So if it's gingivitis, the good news is it's fully reversible. Yes, that's right, it is fully reversible. As long as you're brushing and flossing and coming in for your cleanings, it's gonna get reversed and you're gonna be as good as new. If you have periodontitis, that is a different story, because if you have lost bone level, you cannot regrow it. That is right, once you lose it, it is gone forever. Sometimes you can go to the periodontist and they can widen, maybe sometimes elevate the bone if they do all these crazy procedures, but you cannot do that stuff by yourself. So once the bone is gone, it is gone forever. So if you have periodontitis, the biggest thing you need to do is you need to come in basically right away so you can get at least probably a deep cleaning and then get the oral hygiene just better. Sometimes we'll refer you to a periodontist and they can help get those really, really deep pockets if the periodontitis has gotten quite a bit worse than we can actually treat here at the office. Sometimes they'll help you with the bone level, or if there's recession, they can add these bone grafts and tissue grafts to those areas to help you out a little bit. But remember, what we said is prevention is key. You'd rather not get to this point, so the brushing and flossing is key. We always recommend an electric toothbrush and flossing because we think that is the best way to prevent cavities and periodontitis and gingivitis. If you're doing those, if you have an electric toothbrush and you're using it twice a day and you're flossing at least once a day, you hopefully won't get any of these diseases. All right, there you have it. Now you know why your gums are bleeding when you're brushing or flossing. So you're probably wondering now, do I need a deep cleaning or prophy? Luckily, we have a video for that. So up here, I'm going to show you a video so you know what the difference is between a Profi and a deep cleaning.